There are 3 health checks every woman over the age of 40 should be having, and most are quietly missing out on at least one of them. Not because they don't care, it's because they've not realized the importance of keeping a close eye on these tests, particularly from this age. Hi, I'm Dr. Sylvia, an NHS GP and women's health doctor. In the next few minutes, I'll walk you through all 3, why 40 is the turning point, and exactly what to do next and what to say to your doctor. Mistake number 3. Treating your cervical screening, your smear test, like something you've aged out of. So many women over the age of 40 who've been having smear tests since their 20s. They think, I've had normal tests to date, I'm probably fine now. But this is what's actually true, and this holds whichever country you're watching me from. Cervical cancer is being found in women right through their 40s, 50s, 60s and beyond, which is why the screening guidelines keep inviting you beyond the age of 40. The exact ages and gaps in your invitation can vary from one country to the next. In the UK, you're invited up to age 64. In the US, it's age 65. But the principle is the same everywhere. This is not a young women's test you graduate from. And the longer gaps in between screening that we have these days actually makes it easier to forget. So if you've had a reminder letter sitting somewhere in your mailbox or in a drawer, or you've never rebooked to have your test after having your kids, for example, this is the fix. Rebook that appointment. And if you find the whole thing uncomfortable, like quite a few women do, that's a completely reasonable thing to say when you call to book the appointment. You can ask for a longer session or just ask to have a conversation about your concerns before the appointment comes. Okay, so that's the one that at least most people know about. The next 2 can stay completely silent, no symptoms at all, until when they don't. Mistake number 2, assuming your blood pressure is fine because you feel fine. Blood pressure is one of the quietest numbers in the body. You can walk around for years with your blood pressure running high and feel absolutely normal. For many of us, there's really no headache waving a flag that something is not right. Now, here is the bit that's tied to age. As we move through into our 40s and into perimenopause, estrogen levels fall. And one of estrogen's quiet jobs was helping to keep our blood vessels relaxed. So high blood pressure has a tendency to creep in right at this particular window, no matter where you live, no matter where you're staying. Now, why does it matter? Well, if it's left unchecked, high blood pressure increases your risk of stroke, heart disease, kidney problems, even memory changes that we know as dementia. But what is the good news? It's one of the most treatable numbers that we have today, but only after somebody has measured it. You can get it checked at your doctor's surgery, at many pharmacies, or with a simple home monitor. Just know the numbers. Which brings me to mistake number 1, the check most women are least likely to have had at this age, and the one I'd most want you to book this month, thinking cholesterol and, by extension, heart disease are a man's problem. They're not. Heart and circulatory disease is one of the leading causes of death in women worldwide. But we just don't picture it that way. And so we don't go looking for it. And 40 plus is precisely the age where the picture begins to change. Before menopause, estrogen gives women a natural protection over the heart. As those levels of estrogen begin to fall, cholesterol tends to shift in the wrong direction. You have the bad LDL cholesterol starting to go up, and the protective HDL levels start to drop. So a woman who's had perfectly good numbers her whole life can see them change in this decade. Again, silently, with no symptoms. But here is the reassuring part. A cholesterol test is a simple blood test, and your doctor can look at it alongside your blood pressure to work out your overall heart risk and whether anything heart-missing actually needs doing. Often the answer is simple. First steps, lifestyle changes. But we can only act on numbers that we've actually seen, and it's the one I most often find hasn't been checked for women in their 40s. So, smear, blood pressure, cholesterol. 3 checks, and here's how to sort them out basically in one move. If you're not in a country where you're invited for your over 40 MOT, contact your doctor and ask for a checkup that covers your blood pressure and your cholesterol in a lot of places that can be done in one visit. Step 2, check your cervical screening status. Ask if you're due or up to date and rebook if you're late. Step 3, this is the one that changes everything. Write your numbers down and keep track of them. A blood pressure result or a cholesterol level only really tell the story when you can see whether they are drifting upwards or coming down over time. Now, having a conversation with your doctor or your clinical team, don't feel as if you're making a fuss. Just one sentence. I'd like to check my blood pressure and my cholesterol levels, please. That's all it takes to get the ball rolling. Now, I've created a midlife women's health guide around these conditions that change after 40, how to keep track and what to say during these conversations. The link is in the description, or use the QR code showing up on the screen right now. Grab a copy, it's free. And let me know your experience in the comments. Type me if no one has ever actually sat you down and explained these 3 tests and the relationship to age 40 and upwards for most people. I read all the comments and it genuinely helps me know what to prepare for you next time. Speaking of next time, I'm covering symptoms that most women over the age of 40 simply wave away as a sign of getting older. The fatigue, the brain fog, joint aches, you know what I mean. So drop your question below about this and I might answer it in that video. Don't forget to give this a like and subscribe, and I'll see you over there.